I'm just going to quickly go over our recap of workshop 1. And so I'll skip this part because I think we acknowledge some of the major health challenges and you can put them in the chat. But I would say that two of the big things, and I think we can all agree because this is something that unfortunately all of our Caribbean countries have in common, is this exorbitant rate of obesity and non-communicable diseases. And that can be really related to this nutrition transition that we've seen over the last couple of decades. So if we think about what our parents used to eat, that's not what we're really seeing today. We know that what we eat has been greatly impacted by globalization. It's been greatly impacted by the fact that many of our territories do not produce what we eat. And so we have to import a lot of the things that we eat. And unfortunately, a lot of that food is ultra processed, cheap, widely available, heavily marketed. It's everywhere. And it's particularly accessible to all vulnerable populations, including our children. So we really have seen quite a transition over the last couple of years. And we know that there are a number of factors, but one of the big things is that shift in diet. And so you can see the stats on the slides. We have seen, again, this is what we're seeing across the region. I know I have Antigua and the Bahamas there, but we have seen this great increase in non-communicable diseases, obesity. We no longer want to be known by being having the highest rates of obesity or the highest rates of NCDs and NCD mortality. So we really have to start to make a change. And so we know that we need a multi-sectoral, multi-pronged approach. We need to ensure that in this approach too, that we are appreciating and integrating and engaging persons with lived experience with the conditions that I just mentioned. But one of the greatest tools in our toolbox for addressing these major health challenges is healthy food policy. And so the World Health Organization would have created what they call best buys for addressing NCDs, and these have been endorsed by PAHO and CARFA and the HCC and all the organizations that are putting on this workshop today. And it's a number, if you look it up, it's a number of policies and recommendations. But of course, we know that in order to be effective in our approach, in our advocacy, we have to kind of narrow down the ones that we want to focus on. So these evidence-based policies that we have really been pushing for in the health advocacy space is octagonal front of package nutrition warning labeling. So that is essentially, ideally, having those octagons on pre-packaged foods, and the octagons would say whether this food is high in salt, sugar, and fat so that people can make an informed decision about the food. Unfortunately, we're not there yet, but hopefully we will be. But that is one of the policies that we've been advocating for. We've also been pushing for the banning the sale and marketing, or regulating the sale and marketing of unhealthy foods and beverages in schools, full stop, but particularly in schools. And we've also been pushing for the taxation of sweet beverages of at least 20%. So Barbados, would have done that earlier this year. And Hadassah, we were so impressed with what's happening in Grenada. And we know that's one of the policies that the minister is pushing for. And so one thing I just want to say is that, again, these policies are evidence-based, but also they really work. They're meant to work, and they really do work really well together when they're implemented together. So that's kind of the aim is, yes, we push for one, but you push for one so that you're creating an environment where it's easier to make the healthier choice when you have all of these working together. And so now that we know kind of what we're advocating for, we have to think about how we're advocating for it. And one of those approaches that we've really endorsed and been pushing is this rights-based advocacy approach. And yay, it's Human Rights Day. So again, super appropriate that we're highlighting this. And essentially, using this rights-based approach is acknowledging that a lot of our CARICOM governments would have signed on to conventions that aimed to protect the human rights of various populations, including children, by the Convention on the Rights of a Child, for example. And so using this approach in our advocacy is essentially saying or reminding governments of the commitments that they would have made, of their obligations rather, to respect, protect, and fulfill those human rights. And so, for example, Article 24 in the Convention on the Rights of a Child talks about the child's right to the highest attainable standard of health. So if you're approaching your policymaker, you move from an approach where it's, Minister, I would like you to do this so that our schools are healthier, to an approach that is, Minister, actually, by having signed onto this convention, you need to respect the right of children to the children's right to health and a healthier school environment. So they need to be able to recognize that obligation. And it really does give us a stronger foot to stand on with our advocacy. Mr. Pierre Cook Jr., he would have created this agenda that really outlines what I just spoke about and is the perfect resource if you're interested in using this approach, which I hope you are, in your advocacy. So you can do a quick scan. I think it's also included in your prep pack. And lastly, one of the other things that we would have focused on in the last workshop is this whole idea of youth advocacy in this space. And Tahir Babulia, he's not with us today, but helped to kind of arrange this whole agenda. He would have spoken about the importance of youth advocacy in this space, and he even left us with some tips to consider when we're advocating. So one of the things he said was that, you'll see them here, when we're advocating, think about ways that advocate in a way that aligns with your local culture. So for example, if it's more appropriate or better for you to have a sit-down conversation with a policymaker versus a protest, do what resonates within your culture and do what will work with your policymakers, what will gain their attention and what will make them respond positively. He also spoke about living your advocacy, so aligning your public and personal life. So whatever you're advocating for in a professional space, to also make sure that that's reflected in your personal space as well. And then lastly, he said to seek counsel from partners. So I think this is important for all of us as we are planning advocacy activities, is to think through who's already on the ground, who is doing this work, how can we work with them, collaborate with them, and learn from them. And then we also started or ended workshop number 1 by thinking about smart activities. So thinking about, and you can see some ideas on the right there that some of the groups started thinking about. But one thing, Sharika, who mentioned this, is even before we think about youth leading health advocacy, we also need to think about youth who, how we get more youth involved in this space. And so maybe we need to be leaning on some major social media trends, this main character energy, reminding youth that they can only be the main character in their story by taking care of themselves. So just some food for thought, things to think about. And yeah, so that was kind of an overview. Right now, oh, sorry, we have one more thing, the resources, all of which I've mentioned already, but just wanted to give you a page where you can scan and reference. The one I didn't mention is the Youth Voices and Health Advocacy Spaces. So this is a resource that would be appropriate for all of you on the call. It's essentially a guide for youth who are starting out in their advocacy journey. So would encourage you to scan and have a look.